Jim Colrain, you're on 700 WLW.
Hi, Doc.
How you doing?
You know, I try to listen to your program and not think that you're the devil, but you're helping me today think that you're the devil.
Am I insensitive? Is that what it is, Jim?
No, it's not insensitive. And I understand it's your conservative ideology. I mean, I understand. But at the same time, where's it stop? I mean, like my situation, I have a daughter who's she's a diabetic. She's on a pump. Mm-hmm. And the school has to have a nurse there to help her in
right.
their eyes, give that insulin that she needs to live. Okay, yeah, we could have not put her in a mainstream school, even though she excels, she gets A's, she plays sports, she does very well. Mm-hmm. Or me or my significant other could have, stay at home with her or go to the school. But where does it end? Where, are we going back to the 30s and start housing people for no reason?
So what you're saying, Jim, is you want other people to pay for your daughter's needs.
No, what I'm saying is my daughter deserves the same.
Wait, she deserves.
Thing as everybody else.
No, she can go to school. I didn't say she shouldn't be able to go to school. I'm talking about the funding because she has special needs. You could pay for it, couldn't you?
I guess I could, but could everybody? And where does
it
end?
Where it ends with is you take care of your daughter, I'll take care of my son, everybody take care of their own kids.
There's certain things in this country that this country was put for because the individual citizen can't do it on their own. I can't put roads down.
You can't put roads down, but you can pay for your daughter.
And I do. And I think a lot of people do. But I'm saying, where does it end, Doc? I mean, where?
I just told you where it ends. It ends with you taking care of your kid.
You know what, Doc?
So should I have to pay for your daughter to go to Harvard just because she wants it? Why shouldn't I have to pay for it?
You know what? You're absolutely right. Let's just lop the heads off of any kids that have special needs.
Did I say lop the heads off?
In the dumpster.
See, Jim, now you're being emotional. See, you're an emo, Jim. You're somebody that's not able to think logically because you just get emotional.
No,
Let's
Doc,
lop the heads off the kids. Did I say?
Between you and most people that talk on the radio, they actually think about things before they say them.
Oh, I see. Now, of course, you're going to insult. See, that's typical.
No,
that's typical.
I'm just telling you the truth. I don't think you did your research.
Wait. What did I say that's wrong? What didn't I do my research on? You were talking about opinion here.
We're talking about opinion.
What research did I say was wrong? Did I give you accurate information on the schools? Yes. Did I tell you what nurses have to do? Did I share with you a personal story with somebody that I know that is a school nurse? Yes. What research? What did I say that was wrong? What research didn't I give you?
You just look at it from a very myopic point of view.
So essentially, I'm looking at it from a myopic point of view, but it has nothing to do with research.
No, the research is if you learn about what these nurses actually do.
Didn't I just tell you what the nurses did?
You learned as you were talking, maybe.
As I was talking, I explained it up front. I went down the whole list. I went down the whole list, Jim.
Doc, I'm just telling you.
No, you're not. I got you, and you know it.
Okay,
you were wrong. You are emotional about it.
Cut off the person you're talking to.
No, you are emotional because you don't want to have to pay for your daughter. You don't want to have to pay for her.
No, I want to pay for my daughter. I want to pay, but I don't think every kid that is in my daughter's situation should not be able to go to public school with everybody else.
Then how about this? How about you don't have kids unless you can pay for them?
You know what? Is that going to happen? Is that what society is? And I know that's what the whole idea of you take care of yourself is. And I understand that. I don't want anybody living off me. But there's certain things that as a society
let me make sure I understand. Let me make sure I understand this. Let me make sure I understand. You don't want anybody living off you just said, right? You understand that.
I don't want anybody that's not trying to help themselves.
I see.
No,
but you're okay with living off of other people because you want the city and whoever else to pay for your daughter's special needs. Is that it? That's essentially what you're saying. You are so emotional about this because it's what about the children and what about my child? You take care of your kid and I'll take care of mine. That's the problem. We don't have enough people that's willing to say that. I'll take care of my kid, you take care of yours. Instead, you want somebody else to pay for it because what about my kid? Don't they have a right to? They do. You pay for it. Doc Thompson, 700 WLW. It's Paul Daugherty, Inquirer columnist. How are you, sir?
I'm good. You?
I'm doing all right. What's going on?
You're wrong.
Okay.
Do you have any idea what a typical parent or parents pay in addition to tax money to get their special needs children the help and care that they deserve?
They pay the school, you mean?
No. I'm talking about private physical therapy, occupational therapy, speech therapy, learning centers.
What does that have to do with the school providing extra help for them?
No, you claim to say your bone of contention is that you're paying for my child.
No, we are if they are getting special attention in schools, and we have to have extra school nurses because of these things.
Not necessarily. Do you think that the vast
No.
Don't interrupt me.
No, Paul, don't give me that. This is my show. You gonna let me speak my mind? We can have a conversation or not? Don't interrupt me.
Would you like me to educate you or not?
Paul, would you like me saying I'm going to tell you how to write your column?
Well, you couldn't do that, but would you like me to educate you on something that I know a lot about?
You know what, Paul?
You know what, Paul?
You know what? No, what? I don't want you to. No,
okay,
I don't.
Fine.
No, I don't. In fact, here you go, Paul. There you go. You're done. Don't tell me not to run my show my way. Oh, you couldn't do that. It's all insults. The bottom line is, if I am providing extra money because there are extra services going to special needs kids, yes, my money is going for it. I'm sorry you have to provide extra money for your kid because they have special needs above and beyond that. What about my kid and everybody else's kid having a right to not have to go through these disruptions to get a better education with the money that's out there? Do you know the distraction that special needs kids have in school, that they are to teachers? How much time they take from the teachers, from the school system, the resources that they extract out of it? Now, we can have a good conversation on that, but if you're going to call up and tell me that I'm an idiot on this, tell me how to run my show and not to talk over you, then I'm not going to talk to you. You're a goof.
Minutes, let's go. All right, now, Doc Thompson, tell me. You've never met Paul Daugherty before. Is that fair to say?
I've never met him.
Don't know who he is.
I know who he is, but I don't know anything about him.
Now, what do you perceive from that conversation that Daugherty was about to tell you that you didn't know? If anything.
There was nothing he was going to tell me that I didn't know in that regard. He is an egomaniac, number one. And number two, he is emotionally driven. Here's the whole issue of the kids in school. We pay for those kids that have extra special needs to come in and get things.
And I think significant. I might be wrong.
No, we do.
Significant.
And they are drawing resources from the other kids, sometimes slowing other kids down. Teachers have to spend the time, and this is a real issue. And we can have a conversation on it. That's fine. But he is caught up in the emo of it because of his kid. I understand that. It's very close to your heart because you are in this situation. I get it. But that's the reason I call them emos, people who can only think emotionally. It's all emotion. They can't apply logic because, well, it's my kid, or what about the kids, or what about the rainbows and the puppy dogs?
Well, how do you react to those who say, and I think Paul Daugherty would have made this comment, that federal law requires that these school districts, especially public school districts, have special needs children with all this money being spent, and the school districts have to spend the money irrespective of who else they spend money on?
Well, and that's just the point. I wasn't even saying that there isn't a federal law. Of course there is. The federal law is an issue. That was the whole point of this, that we have to pay for the special needs kids. We're paying through the nose for this stuff. And you compare it with 50 years ago, what's the thing that's changed with schools with regard to nurses and some of those services we provide? The thing that's changed is now it's special needs kids. And if we're talking funding, we can't get levies passed. The schools don't have enough money. They're going down the tubes. We've got spending issues all over the place. And can you imagine my arrogance to actually talk about the way things used to be and say maybe there's some of those things we can look at and consider? Right. The federal law is wrong on that. Doesn't it make more sense to say we can put special needs kids in a couple of places together and be able to service them better, number one, and number two, save some money?
But that's not the law. The law says you have to mainstream them.
Right.
And the law says you don't put them in their own little institutions anymore. The law says you got to keep them in the public school system. And if the parents decide the kid belongs in Madeira schools or the kid belongs at Lakota West, the school district has the burden of spending the money to make that happen.
Oh, yeah. Imagine if 50 extra kids moved into any of those districts that had severe special needs tomorrow. What's that going to do to your budget right now when we're in so much budget trouble? Horrible situation.
A whole bunch of people.
Hey, don't interrupt me.
No, I'm sorry. A whole bunch of people are going to be paying a whole lot of money.
How about this? Everyone keeps talking what's fair. Isn't it fair for my kid to go? It needs to be fair. Don't they have a right? Don't they deserve? Yeah, they do. How about they have a right to the same services every other kid has? You bring them into school, fine. They can be taught all of these things. But if they have special needs with special computers, desks, equipment, or nurses on hand.
Teacher assistant.
With
the child.
If that's the case, then it should be, even with federal law, you pay for it. I got no problem with that.
Treat everybody the same.
Treat them the same. But that's not what they're talking about.
No.
Federal law and people like Doherty are talking about special. They're going to get more services and drain it from everybody else. What about the kids that are there right now trying to learn in a class and the teacher has to keep stopping? I just had one of our coworkers tell me this in the hall, that their wife had this situation where she kept being, she was working as a teacher for a while. She kept being drug away for the special needs kids. She wasn't able to teach the other kids, give them all the time. It's crazy.
Yep. Well, that is a big issue, but guess what? The so-called disabled lobby has won the issue because federal law says these school districts have to do it, and the state mandates certain things. And so you'd have to change federal law in Washington. You'd have to go to John Kasich and get it changed under Medicare and Medicaid, and that is one hell of a fight to get. And they've won the last 20 years. Started with the ADA with Bush 41, and legislation is built up, and now the bureaucracy's built up. And thousands of federal jobs are at stake of bureaucrats who enforce it. And all it takes is a phone call to some bureaucrat saying that Lakota West or Mason is not doing this or not doing that. An investigation is launched.
So now you got Lakota saying parents are going to have to drive their kids or find another way. They're going to cut busing. And at the same time, you've got services being drained by special needs.
And let's face it, many times the special needs child, for all kinds of reasons, when they get to be 25, 30, 35 years old, don't suddenly become rocket scientists. The level of their life isn't such that they can really contribute back to society much because of their limitations, which any of us could have at any point in our life.
Right, exactly. I'm not saying that. I'm not saying it can't happen to anybody. Right,
Stroke, heart attack.
Could happen to any of us at any time. Any of us could have a kid in that situation. I'm not saying any of that. I'm not saying the kids don't have a right to get educated or anything. I'm saying, can we think about it logically instead of emotionally and saying,
no,
let's be as efficient? No, you can't.
No,
it's all emotion.
No.
What about the kids?
If it's your child, you can't think logically.
Right.
You've gone. Because he brings up the point. I spend money for occupational and for speech therapy and behavioral therapy. I spend all this money. But the problem is when you come to the taxpayer and say, I want you to spend your money on my child. That's the problem. We got to take a break. Can you hold on for a minute? Let's hold on. We have thousands on hold, millions listening. A great debate has now been joined between Doc and Doc on 700 WLW. So that helps. All right, now, Doc, are you willing to face the American people? Do you want to sit there and just complain about the way things are without trying to address the problem?
I'll face him anytime.
You'll face the American people.
Yes,
so if we live in the land of Doc Thompson,
yes,
what would you do with disabled kids? I guess you can't say crippled kids anymore. Profoundly disabled kids who look upon school as kind of a hiatus away from the misery of their life, and the parents are advocates for this child. And if you had a kid like that, or if I had a kid like that, I'd be just like Paul Daugherty.
I can understand.
I'd be emotionally invested in saying society owes this kid something.
I can understand the emotion invested. I certainly would be an emotion. My son, when he was born, had some health issues. My ex's water broke. I think it was 12 or 13 weeks early. And she was in the hospital. He had to be in the NICU for 9 weeks and had some trouble starting off. So I can understand the emotion involved.
Nobody's
in it.
perfect. We all
Nobody's perfect. I would say you're entitled to the same services that every other child is entitled to.
That's not the law, though.
Well, I know it's not. I mean, the law should really be changed. We've turned into the politically correct, emotionally driven society instead of saying everybody's entitled. If you really want to talk fairness, then make it fair. You're entitled to the same things, the same amount. You go to school, fine. Anything above that, the parent needs to pay for it. I mean, he could stay home with his daughter as well, to use Doherty for an example. He brought it up himself. He could stay home. He could do those things. They could hire somebody else. But what they really want is, it may not have been him, might have been the caller before. Let me clarify that. That they could stay home. They could take care of those things. They just want everybody else to pay for it.
All right, let's continue. Are you willing to face the American people as you hung up on Paul Daugherty, a living legend in this town?
He deserved it.
All right, let's continue. We have George on the cell phone, then John and many others. And George, welcome to the Bill Cunningham Show. George, how are you? Hello, George? George. George's not there. John, welcome to the Bill Cunningham Show. John, how are you?
I'm doing all right, Billy. How are you?
You give me and Doc a live update.
Hey, I'll tell you what. John McCain introduced the ADA there, pal.
1989, something like that?
So then we
That's
know it's
right.
good.
Well, it's got to be
Yeah,
good.
it's got to be good. He didn't make it president, but he sure saved a lot of us, and I include myself in the ADA. I had a learning disability growing up,
Yeah.
and I was mainstream. And Arthur Fonzarelli was a dyslexic, and Einstein himself was a dyslexic. So
Well-
there are people that contribute back into society that happen to need that special services.
Well, John, let me put this burden back on you. What if we live in a society where we have limited dollars and almost unlimited needs of various kids? Do you have a full-time teacher assistant for each child who's there
No.
who is disabled?
No, what I do is I get each teacher nurse assistant certified so they can contribute the medicine, distribute the medicine that they
Wait a
go
minute.
along.
So you're saying each teacher needs to be what?
A certified nurse's assistant,
So a
which only
teacher.
takes 6 weeks.
All right, so
And with the nurse there, they can distribute medicines that need to be distributed.
So, John, you're in the middle of an instructional class about geography, spelling, mathematics, and you stop class. Then you suddenly become a nurse and walk up to a special needs child and administer medicines to that child?
Pop a pill. Yep, that's the way America is anymore. Anyway,
What do the other 25 kids do while that's going on?
I guess they sit there and wait for a second.
Then what? And what if that's multiplied 100 times by a...
Then, I guess they get a wider variety. They get to see what life is really about. Not everybody is the same.
Okay.
And what's it going to hurt a kid to see somebody with problems growing up?
Well, that's fine.
That's not the same.
That's kind of the wrong ground upon which to make the fight. The ground is this. There are limited dollars. When you have parents driving kids to school every morning, you get rid of lunches and dinners. You get rid of extracurricular activities so that 100 special needs children have teachers' assistants with them all the time. Isn't that saying to those other kids that don't have special needs that your needs are not as special as someone else's, and we're going to spend the money that could be spent on band and on athletics and on buses, we're going to spend it on a teacher assistant. It's either or.
Well, I guess you're right. Well, once again, I stand corrected.
All right, consider yourself corrected. Would you agree, Doc Thompson?
I would agree.
All right, let's continue. But I think in some large school districts like Anderson, where Darrell Parks resides, I bet there might be hundreds of kids in one sense or another that have a special need or ADA or diagnosed. Then what?
Mm-hmm. Well, and the reason we got here is because of Forrest Gump.
Forrest Gump cost
Forrest Gump.
Forrest Gump.
That's the attitude. Everyone sees Forrest Gump and goes, look, with a little extra. They didn't hold him back. They encouraged him. Look, he met several presidents. He won the Congressional Medal of Honor.
He met
whatever.
John F. Kennedy, didn't he?
John F. Kennedy did
He
all
met
of those things.
Johnson.
Johnson was a war hero. All of those things. And that can happen. And sometimes it doesn't. But you can't get caught up in the emotion of it.
Let me tell you a story about, I have several friends of mine who are teachers, and one works in the inner city. And very few of the children in the inner city come from, shall I say, functional families. They're dysfunctional. Right. One of the games played in social welfare agencies is to have your child declared to be ADD, because there's a $476 a month check that comes with the ADD diagnosis. And
I'm sorry, did you say something?
No, I didn't. And a Medicaid card. So you get free medical, so many times free dental. You have a check every month, assuming your child is diagnosed a certain way. And then the school has to red flag to make sure your kid never flunks a class. And they don't have to do homework because they have ADD.
I'm sorry, I was thinking about something else. Do I get extra money for that?
Is that $476?
$476. You lost me.
Because I think I might be a little ADD, and I think you might be a little ADD.
I have no idea what you're talking about. You lost me. I was watching television.
But when we were growing up, no one was diagnosed with ADHD or ADD, and as a consequence, we weren't paid to have the condition. Today, you're paid to have that condition.
Yep.
And it goes on and on and on and costs us. There's an entire industry like that.
But Willie, here's the problem. This is unsustainable. All of this is unsustainable. Where are we going to be 50 years from now? We can't keep spending. We don't have the money. What do you want to do?
I think 5 years.
Yeah, 50 was generous. Probably 5.
Because we have a city we can't afford, $60 million. We have a county which is about $300 million upside down. We have a state with about $9 billion. Kentucky's about $1 billion, and we have a federal government that just a couple days ago went and spent another $1 trillion.
Think about the prioritizing of the city, okay? The two issues. Gamble House, they want to buy it for $300,000 and continue to upgrade it and run it. $300,000, they got a $60 million deficit. You've got the trolley car. How many millions are going to have to put into that on top of the federal?
In fact, I met today with a member of council who told me they're budgeting approximately $12 million a mile. Think of $12 million a mile. A mile. Uh-huh. In reality, they think it's going to be $30 million a mile to maintain it. Okay. Because when you put the streetcar there, that doesn't mean like, okay, it's done.
Right. Yeah, you got to upgrade and continue to run it. So those are the things they're spending money on. Meanwhile, they're saying we can't afford the nurses and we can't afford fire and police. And then fire and police, they continue to upgrade and grow those or whatever. Schools, they continue to spend more money on schools and nurses. And why? The center of this whole thing, because things have changed and we are now emotional and say everybody ought to have and everybody's a victim and redistribute the wealth.